Hello dear colleagues, I am Dr.Hanee Hashim. I will present you a clinical case about extruding a lower displaced canine using a cantilever. This patient was referred to me to continue his orthodontic treatment. He was 36 years old. He was a heavy smoker and his oral hygiene was very bad, as you can see. He wanted to continue his treatment without bonding the upper teeth. It is obvious that the previous mechanic to move the lower left canine was completely wrong, and it had many side effects, such as unwanted movement to the right canine, and it also affects the oral hygiene negatively. So we should think about another mechanic to achieve our goal. Our mechanic's goals were opening adequate space for the canine, and using the simplest and most effective method to pull the canine mesially, upward and inward. Cantilever can do that effectively. When we make a quick literature review, we can see good articles like this one, supporting the use of cantilever in such cases. They reported that one couple orthodontic appliances can increase the predictability of tooth movement, reduce the need of appliance reactivation, and the occurrence of possible intra-arch unwanted side effects. So, I started my treatment from here. I put an open coil to provide a sufficient space for the canine, and a cantilever was made from 1725 stainless steel wire. This is the passive view of the cantilever. We should remember that the required movement is upward, forward, and inward. So, the cantilever must take the shape of the arch like this picture. This is the cantilever when it was activated. After 1 month of treatment, more mesial movement was needed, so a longer cantilever was used. And this is the progress of treatment after 3 months. 5 months later, the canine was engaged with a straight wire with a very light force. After 8 months, a bracket of upper left premolar was bonded to the lower canine to get sufficient root torque and tip. And 20 months later, Warren spring with 1925 stainless steel wire was utilized to get extra root torque. After 24 months, the case was finished. CBCT was done to check the position of the canine. It's clear that a sufficient root torque was achieved. So, the brackets were debonded, and this was the result at the end of the treatment. At this point, I wanted to do a periapical X-ray for documentation and to make sure that everything was okay. Fixed retainer from the lower left first premolar to the right canine was bonded, and a vacuum foam retainer with extension to cover all the clinical crown of the lower left canine was used to support the canine and reduce the probability of relapse. Now, a big question is arised. What about periodontal tissues? The answer is here. You can stop the video and read this text. The brief answer is, the periodontal prognosis of this tooth contrasts sharply with the success of the orthodontic treatment. However, the patient was referred to our periodontist to do a pregingival graft for the canine. Finally, I think that these presentations are highly recommended. The first one is made by Dr. Chang. Dr. Chang used a cantilever assisted by TAD to extrude an impacted lower canine. And the second one presents a case treated by Dr. Wyatt. He used intermaxillary elastic to extrude the impacted lower canine. In our case, we should remember that no TADs were used no intermaxillary elastic were utilized, and no brackets at the upper arch were bonded. I hope that this presentation was useful to you. Thank you very much for your attention, and see you later with another case.